across the border in the Montreal area.
Cool.
So
Okay.
We are at noon.
Great.
Well, welcome everybody. I'm Jonathan Slater. I am director of the Institute for Ethics and Public Life at the State University of New York in Plattsburgh. We are hosting this amazing conference today, and we have two amazing speakers in our track right now. We have Laneceya Russ and Yuliya Labko, and their presentation is called Maternal Death for American Indian/Alaskan Native and Non-Hispanic Blacks in the United States. If you are missing other sessions right now, or another session right now because you have decided to come to this amazing session, you can catch up after the conference because everything is being recorded. And if you have questions for our speakers at the end of their presentation, just type them in the Q&A part of your little Zoom dashboard. You should have access to that. I'll be moderating within the last several minutes of the presentation and sharing those questions with our speakers. So first, let me introduce Laneceya Russ, who is the Executive Director of March for Moms. She has a master's degree in communication from University of Louisiana at Lafayette and a bachelor's degree in communication studies from Louisiana State University. Laneceya currently volunteers at Baton Rouge Youth Coalition, is a regional council member of sexual trauma awareness and response, and a board member of the Louisiana Crime Victim Reparations Board. Yuliya Labko is the Advocacy and Policy Director of March for Moms and a full-time certified nurse midwife. She holds a master's degree in nursing from Johns Hopkins University and a postmaster's certification in midwifery from Shenandoah University. Yuliya works at Abington-Jefferson Health outside of Philadelphia, providing full-scope gynecologic, reproductive, prenatal, birth, postpartum care to people through the lifespan. She also volunteers with the American College of Nurse Midwives as a mentoring program coordinator for students and new midwives. Welcome, Laneceya. Welcome, Yuliya. The virtual floor is now yours.
Thank you. We're going to share our slides here momentarily. Are you able to see them, Laneceya?
I am.
Great.
We just have to start the slideshow.
Awesome.
All right, we can go ahead and get started. Good afternoon, everybody. My name is Laneceya Russ. I'm the Executive Director of March for Moms.
And I'm Yuliya. I am the Advocacy and Policy Director for March for Moms.
And we just want to thank you and welcome you to our presentation. And thank you, Jonathan, for that wonderful introduction of us both. And we can go on to the next slide. First, I want to talk a little bit about who we are at March for Moms. So we were actually founded in 2017 by a midwife and an OBGYN. Originally, they wanted the organization to increase awareness around maternal morbidity and mortality that was happening in the United States. And we have evolved over time. Our mission for March for Moms is to align the diverse voices of families, healthcare providers, policymakers, and partners to advocate for mothers and families' health, well-being, and equal access to care. We envision a future where everyone can grow their family with dignity. So first, I want to give you all some definitions of what maternal mortality and morbidity is according to the CDC. So maternal mortality is a pregnancy-related death as the death of a woman while pregnant or within 1 year of the end of pregnancy from any cause related to or aggravated by the pregnancy. And maternal morbidity is the unexpected outcomes of labor and delivery that result in significant short or long-term consequences to a woman's health. So we want to talk a little bit about the trends that is currently happening and have historically been in the United States. So the United States has the highest rate of maternal death out of every high income country. And what we found is 60% of pregnancy deaths are preventable. And 1 in 6 women report feeling disrespected by healthcare providers during their pregnancy. And here are some of the reasons why that's happening. So the reasons maternal death rates are on the rise in the US include poor access to healthcare. So more than 2.2 million women of childbearing age live in maternity care deserts. So maternity care deserts are areas where there is no hospital offering obstetric care. There isn't a birth center or an obstetric provider. And an additional 4.8 million women of childbearing age live in counties or parishes, since I'm from Louisiana, with limited access to maternity care. And access to quality maternity care is a critical component of maternal health and positive outcomes. And going back to the stats a little bit, approximately 700 women die yearly due to pregnancy or delivery complications. And it's even worse for women of color. So maternal death for American Indian and Alaskan Native and non-Hispanic Black women is 3 to 4 times more likely to happen compared to white women. And so when we talk about racism, discrimination, and disrespect as a reason that death rates are on the rise in the US, so historically, Black families were barred from quality hospitals and being able to receive care. And so these inequities have persisted. And so what we have seen is racism and bias adversely affect the quality of care that Black families receive. And then the lack of integrated care models that address medical, behavioral, and social needs comprehensively. And Yuliya would talk more about those care models today during this presentation. And along with that is the misaligned incentives for health systems with maternal health outcomes. And so because of all these barriers, this is why the US has the highest rate of maternal death out of every high income country.
Thank you, Laneceya. That was a great setup. I will be touching on the maternal healthcare models in the United States particularly, and I think it's important to talk a little bit about the history of maternal healthcare, or a very brief history, in order for us to better understand why the systems in which we function now exist. And so I wanted to talk a little bit about where birth came from and the settings that birth was performed, or where people had their babies prior to our current system. So majority of births were attended by midwives until about the late 19th century. Many of those midwives were Black, Indigenous, or of immigrant status. And then in the earlier 20th century, childbirth really became more medicalized. And as that trend happened, physicians really emerged as a primary birth attendant, and childbirth moved from the home to the hospital settings. And this trend is also mirrored in the statistics at the time, where about half of the babies were delivered by midwives in the United States, and in the early 1900s, and then not even 25, 30 years later, that figure dropped to about 15%. Today, the rate hovers around anywhere from 11 to 14%, and every year the number of births attended by midwives rises slowly. So we're kind of inching back towards that trend. However, there's still a lot of work to be done. Most of the midwives that attended birth prior to it transitioning to the hospital setting were really coming from more of a traditional healing knowledge and learned their practice through apprenticeship. So being apprenticed under the apprenticeship of another midwife or a local physician in their community. During this time, as this transition happened, part of the reason why it happened is that there were increased rates of maternal and infant mortality. And a lot of the obstetricians and public health officials, along with social welfare reformers, blamed midwives or community midwives, despite the evidence from several research studies that midwife attended births that, they didn't really account for rising maternal deaths. There were actually fewer maternal deaths. But the public health officials joined obstetricians in order to use this argument to eliminate traditional midwives. There was a very robust campaign that called Black, Indigenous, and immigrant midwives incompetent, unsanitary, and dangerous. A lot of maternal deaths and neonatal deaths that were related to infection were blamed on these unsanitary practices, which was not the correct cause. This is a photo of midwives gathering on the steps of Canton, Mississippi. I just thought it would be great to share kind of the midwife class and like what midwifery looked like at the time, because as I will touch upon a little later, the demographics of our profession have changed quite a bit as well. As part of the broader effort to reduce maternal mortality and infant mortality rates, Congress also passed the Shepard-Towner Act of 1921. This regulatory initiative provided federal funding to establish midwifery training and licensure, and it was set up under the public health departments. So midwives were trained by public health nurses within the public health departments. And in order to be licensed, they had to undergo training and submit supervision, proof of supervision. And this kind of continued to evolve. And today, most midwives in the US are trained as nurses first, and then they continue on to obtain their midwifery degree as a master's in nursing. So I am a nurse midwife. I am trained as a nurse primarily first, and then you move on to the midwifery training. And really, as a result of these predatory and restrictive policies, only about 6 to 7% of all midwives today identify as Black, which is really not reflective of the population that we serve, really broadly geographically, but specifically where majority of midwives practice. And as Laneceya mentioned, you know, there is a rising trend of Black, Indigenous, and Alaskan Native women and childbearing people experiencing higher rates of death and morbidity. And we have great research showing that people are more comfortable and receive better care from providers that look like them. And if we're serving the population that midwives are majority white, and if we're serving the population that is not, that is a big barrier to providing good, not just good care, but really really sensitive care that meets people where they are and makes them feel comfortable and makes them feel like they can trust their provider. So the midwifery model of care as a definition is really based on the core understanding that childbearing women are undergoing a healthy, normal process of their lifespan. So as midwives, we really learn to monitor and identify when higher levels of care are needed, but in general, we center the experience around the childbearing person and family. And the midwifery model of care really emphasizes a trusted relationship and promotes health practices and provides information that birthing people need to make their own informed care decisions. And really, we pride ourselves in personalizing care and tailoring it to the individual and to the family we're serving. And that's really at the heart of what the midwifery philosophy is. Majority of midwives currently in the United States practice within the hospital setting, meaning we attend births in the hospital. Over 95% of us do. There are also midwives who work in freestanding birth centers or home environments where they attend births at home. Nurse midwives and midwives outside of the nursing profession, which I'll touch upon a little bit later, provide gynecologic care, birth care, postpartum care. We also prescribe contraception and can see our clients for primary care concerns. So really the bottom line is we're there for individuals through the lifespan. And as I mentioned, there are more than just nurse midwives. So there are 3 nationally recognized midwifery credentials. And I don't want to spend too much time on this because it can get very detailed, but I wanted to put this graphic up to show you a little bit of a difference between the three. The legal recognition column, that column also changes as more states are recognizing different types of midwives. So like I mentioned, the certified nurse midwives are the predominant type of midwife you may encounter, but there are other ones, and you're welcome to refer to our references for more information if you want to dive deeper. So what are the benefits of the midwifery model of care, and how does it relate to racial disparities that we see in outcomes? So really compared to physician care, which is more, the obstetric model is more based on pathology and more procedure oriented, whereas midwifery care has been associated with less interventions being used, like electronic fetal monitoring, less use of any kind of pain medicine, including the epidural. And that goes back to providing more one-on-one support and being with women and childbearing people through their labor. We also perform less episiotomies. There is an increased rate of spontaneous vaginal birth without the use of forceps, without the use of a vacuum. More vaginal births after a cesarean. So if somebody is a candidate to trial a birth, a vaginal birth after they've had a C-section, midwives are able to provide care to those families. Improved initiation and continuation of breastfeeding. Again, that goes back to support. This is especially clear and obvious in settings of Black midwives providing care to Black families and providing that support for people to troubleshoot with breastfeeding, and really coming from a place where a family is comfortable asking questions and continuing this really special bond that is both beneficial for mom and baby. Better psychological experience, more sense of control, higher satisfaction scores and confidence, and feeling really good about your birth experience, or really about your care experience. Again, that goes back to culturally competent healthcare providers and providers that look like you, providing care for you, which is always going to make a family or the patient more comfortable. Last but not least, lower costs. Our healthcare system is very profit driven, and midwives can provide midwifery style of care and bring all of these improved outcomes to women and families at a lower cost to the system. Before I dive into the slide, I just want to mention that midwifery training is also more cost effective than training an obstetrician. So our time of training is much shorter and costs less than the training of a physician or an obstetrician. They are obviously possessing different skill set, which is really important, and we want more obstetricians as well. But as the system evolves and the need for obstetric providers rises, midwives can meet that need quicker in a lot of the areas. I'm going to move on to the policy solutions to improve maternal health care to kind of tie in this conversation we've been having about the midwifery model and other initiatives to help combat maternal deaths in the United States. I'll start out with a little bit of example of things that have passed already as this issue has gained visibility in the past 5 to 10 years. So one of the pieces of legislation that has recently passed in the past 5 years is the Preventing Maternal Deaths Act of 2018. Then President Trump signed it into law, which authorized the CDC to increase support for state and tribal maternal mortality review committees. Maternal mortality review committees are committees that are local and community-based, and various folks from the community, from healthcare providers to religious leaders to industry professionals and consumers and families, meet together to review a maternal death that has happened in the community and try to pinpoint where there was a lack of care perhaps, or access to health care that could have caused this death. And then they come up with recommendations for the future to address any kind of issues in the community, whether it's transportation, lack of healthcare provider, lack of education, and many more reasons. There's also a big push for state coverage for doula care, and there are a few states that have state Medicaid coverage for doulas who are trained labor support persons. They're not a clinical provider, but they're very important and have been shown to improve outcomes and satisfaction for families and childbearing people. Funding for clinical research on equity and implicit bias. For example, California has passed this law where healthcare providers are mandated to attend equity and implicit bias training. We all have implicit bias, and it's really important to recognize implicit bias and learn techniques and address implicit bias in healthcare in order to prevent poor outcomes. And California has kind of been on the forefront of this, and hopefully more states will follow. Lastly, but not least, most recently, the American Rescue Plan Act, which was signed into law on March 11, 2021, made available additional pathway that allows states to extend Medicaid coverage for pregnant people from 60 days to 1 year postpartum. A lot of deaths happen in that 1 year postpartum, and part of the reason was access and is access to care. And many women, as their Medicaid coverage dropped off at 60 days, if they experienced health issues, would not seek care because they did not have insurance. And so lots of studies have shown a decrease in morbidity and mortality if people have access to care up to 1 year postpartum. So this allowed states to have this option, and hopefully this will kind of continue to be the trend so we can provide better coverage to all people postpartum.
All right, so I will talk about the current legislation that is moving through to address maternal health care in the United States. So one big package is the Black Maternal Health Omnibus Act of 2021. So that legislation package addresses a number of things. So some of them are social determinants of health, things such as like nutrition and transportation. It provides financial investments to community-based organizations. So we know that community-based organizations are on the ground doing the work, serving their communities. However, they are often under-resourced. So there is a bill that could provide them with funding so that they can serving people pregnant and postpartum veterans. There was one to diversify the perinatal workforce, which Yuliya talked a little bit about, making sure that there are perinatal workers that look like the communities that they are serving, and they can provide culturally congruent care. There's also some other bills included, such as data collection and maternal mental health, and support for incarcerated moms, climate change risk, and so much more. Last year, we only had one bill that was passed and signed into law, which was the Protecting Moms Who Serve Act, which center care for pregnant and postpartum veterans. We also have the Moms Act, which would permanently authorize an annual funding program for accredited midwifery education programs. Then there's the Maternal Care Act, which would create 2 new grant programs and direct a study focused on reducing racial health disparities in maternal health. And there's also some state legislation that has passed. So one was remote monitoring, which provides burden people in rural areas with access to care. And so we've seen that pass in Colorado and Tennessee. There's also doula coverage that is being passed, and you may have heard of that in New York recently, as well as some midwife advanced practice nursing scopes and MMRC funding. So what can you do to help us improve maternal health and advocate for change? So one way you can do that is by becoming involved in your local community. This issue affects everyone. It doesn't just affect women or birthing people. So in how we treat families in our country is a barometer for societal health. So talking about this issue in your local community, raising awareness of the rates in your community or your state, and being able to come together as a collective to advocate for change. You can also schedule meetings with your state and federal officials and voice support for some of the current legislation that's moving through, whether that's state level or federal level. It is quite easy to schedule a quick meeting with a state or federal official. You can do that a number of ways: by emailing, by going on their website to schedule some time. You can also call them. There are scripts across the internet on things that you can say to share your experiences and stories and get your point across, and continuing to spread awareness. Like Yuliya mentioned, maternal health care and morbidity and mortality has really became visible in the last 5 to 10 years, but there's still some people who don't know these stats and don't know how it affects birthing people, specifically Indigenous and Black, non-Hispanic Black women, and be persistent. So like I mentioned last year, there was only one act that was passed into legislation. And so we have so many more to go. And so being persistent by, continue to talk about these issues, advocating for them with your elected officials will go a long way.
Thank you, Laneceya. That the steps you can take are quite universal, and I know they've been touched upon in other great presentations this morning. I've compiled just a quick list, and this is not by any means comprehensive, because there are lots of resources, as Laneceya mentioned, to help us reach out to our legislative officials. One is our own March for Moms toolkit, and it's called Becoming an Effective Advocate. You can find that on our website, and it's linked here. And that provides you a step-by-step guide, how to find your official, how to reach out to them, what to say. We also provide statistics and help you become really informed before you meet with your legislative official or their aide within their office. Many times you won't meet with the actual official. They're very busy and they're traveling a lot. So don't be discouraged if you meet with an aide. They're a great resource and act as a point person that provides a summary to the official. So they're very important and do a great job. Every Mother Counts is another great organization that has an advocacy toolkit you can check out. You can voice your support for the Black Maternal Health Momnibus, which is the package that Laneceya mentioned of bills on the Black Maternal Health Caucus's webpage that also provides you with instructions on how to reach out. Checking out your professional organization is helpful if you are in some sort of healthcare, nursing, social worker. A lot of professional organizations in that arena have resources and information about how to get involved in advocacy. So you can always apply their resources to this topic as well. It can be daunting and scary, but the thing to remember is that you're the expert, even if you did not have a personal experience with this issue. The fact that you care and you can bring a personal story about how much you care, or about your family or anyone that you know, or anything that you've read about this topic, is really, really important. You do not have to know every number and every statistic to have a meeting. I think when we're all new starting out, it can get really nerve-wracking, but just know that you don't have to be a 100% expert in this topic. Just showing up is more than half of the battle. And then last but not least, consider attending our March for Moms event. We have an annual event this year in Washington, D.C. We prior to the pandemic, we held one yearly. And this is when we raise awareness and reach out to the public to talk about all of these issues and statistics and really bring a voice to this topic from consumers and experts to reach out to the public and to legislators. And you can also experience some advocacy in action during our more fun event.
All right. So we wanted to link our contact information here. We sure that you all may have questions that we couldn't get to in 30 minutes. And so if you would like to reach out to Yuliya and I, we have listed our contact information here. But for now, we will take any questions that you all may have.
Yes, thank you, Laneceya. Thank you, Yuliya, for that very instructive, enlightening, and engaging presentation. Some really solid points you made. So if any of our attendees has a question or a comment, please share them in the Q&A. And if for some reason you do not have access to Q&A, you can put it in the chat. I will be monitoring. Both. When is that Washington event? I might have missed the date. When is that going to be?
So it will be happening Sunday, June 5th.
Oh, okay, so that's the okay. Very good. Okay.
Yeah.
June 5th.
It's
excellent.
It's a free event, and we have a variety of speakers to address many of the topics we mentioned. And then we also have performers and a DJ, and we really try to have a family-friendly event for folks to show up and learn a little bit more whilst enjoying some in-person outdoor time, which I know we're all been short on these past couple of years.
I'm not seeing any open questions or anything in the chat, but I'll go ahead. I'll get us started. We do have students from the U.S. and the U.K. and Canada attending today, and what would you suggest, or what would you recommend that someone who's, for example, an undergraduate or a graduate student in any number of disciplines, whether it's anthropology, sociology, healthcare, what can students be doing in terms of their own edification, their own education? What would you suggest that students do in order to start to build their knowledge, their awareness of these issues, and also to become active, not just sort of passive consumers of this information, but what can a student do to become active in this area addressing these issues?
You want to start, Yuliya, or would you prefer us?
I can do that.
Okay.
So the top things that come to mind is I think a lot of professions, like in the field of nursing, medicine, sociology, have really robust professional organizations. And I would really recommend joining them as a student. I joined the American College of Nurse Midwives as a student, and that provided me a lot of tools on how to feel like I'm part of a larger community and how to reach out to people who make a lot of decisions, including legislators. Many organizations hold advocacy days and provide materials and statistics and webinars on the information, the content, but also how to utilize that content and talk to people in our communities and legislators. So I would definitely check out your professional organizations. Sometimes they do charge a student fee, but I would say that's very much worth it for what you get out of that. And you get to meet people and network in your own profession. You can also utilize social media. I think that is a really big newer thing in the past 10 to 20 years that has been a big tool in maternal child health, or really any kind of advocacy, is using social media to reach out to legislators and the public, but really to also make people in your own life aware. I'm a midwife and I talk about my profession everywhere I go because many people don't know what a midwife is and what we do. So just having conversations every day about the work that you do or what you're studying is super important. So.
And I was just going to add that if you are passionate about maternal health and reproductive justice, starting student organizations on campus is always a good way to get involved. So we have been in contact. There is a student organization centered on maternal health care at Tufts University. And so if that's something that you're extremely passionate about, we can always connect you with some other student groups that's putting on programs and advocating for change on their campuses.
Excellent. And I'm guessing that some of these groups have something like a turnkey toolkit that can be used in order to start engaging actively on some of these issues.
Absolutely.
Yeah, many times they do. And Laneceya and I have a fair number of students reach out to us as either part of their assignment or just wanting to learn a little bit more about the topic. Do not be shy. Always reach out to the folks on the website for the organization you're interested in. We're really happy to hear from everyone, but especially students, I think, have such a great energy and are really happy to get involved. So whether it's with us or an organization that is really of interest to you, please reach out and connect with people that run that organization. There's nothing super special about us. We're happy to talk to anyone. So don't be shy and reach out to folks for sure.
Excellent. Excellent. Please put your questions and comments into a Q&A. Oh, we have one. Hold on a second here. Yes. Okay. Jana DeJoy says, I would love to hear the speaker's perspectives on the intersection of environmental racism / environmental justice issues with maternal health and access to care. Do you have an example of a policy solution in this area?
Oh, I could talk a little bit about that. Thanks for your question, Gianna. So there is current legislation that's a part of the Black Maternal Health Omnibus centered on climate change, and we can definitely drop it in the chat. So that bill centers things such as like disaster assistance and transportation when it comes to having moms and birthing people, having to bus to appointments and in the middle of a heat wave. So it does addresses some of the climate injustices faced by families. Another thing is for us, because we know this issue was so timely, we hosted a workshop last year on preparing and responding to natural disasters and climate change events. And so I am from Louisiana. So last year, Hurricane Ida hit us, and I noticed the impact that maternal health organizations was having, providing mutual aid to families that were impacted and displaced, providing supplies for things such as diapers. And then when Yuliya and I were researching further, we found that there were other similar maternal health organizations providing care to families after things like the winter freeze in Texas and wildfires happening on the West Coast and water crises. And so we brought them all together to share their programs in hopes that other organizations can replicate or implement some of the programs to provide care to families when climate change events happen in their area. And I'm sure that Yuliya might have something to add to that as well.
Yeah, that was great. That was a great event. I think all the work that community-based organizations do is really, really important to reach families in their time of need. I think a lot of the legislation and things we talk about like big picture are great, but when these events happen, the community-based organizations and the providers during these times in the area are the first responders, for lack of a better term. So it's really important to elevate their work. These are organizations you can also get involved in your community and support them financially or through volunteer work. But the thing that I was going to add is that we also know that families of color are disproportionately affected by harms of climate change because they live in areas that are typically more polluted and have worse air quality, worse water quality. And it's really hard to ignore the effects that has on family health and especially maternal health. This is also applicable to rural families. Fracking is a great example. There's a really big study that found fetal effects and maternal effects that are poor on when families live in an area that has hydraulic fracturing, which is a way to extract natural gas. And this was associated with lower birth weights, with preterm labor. A lot of the chemicals used in fracking contribute to that. In areas of poor, water and air quality, there are similar effects. There are higher rates of childhood asthma, and we can go on and on, obviously, about the medical consequences. But really, this is due to systemic racism and systemic policies that were implemented over, centuries that resulted in families living in these areas. So we must address it on the policy level, but we can't ignore the current effects that people are experiencing as well, as healthcare providers specifically too.
And I also,
go ahead.
Yeah, I was just gonna mention that I did put that bill is to protect the moms and babies against climate change. It is a federal policy that we hope to pass. So you can check out more about that text and what it would do for families in our country in the chat box.
That's the link that you put in there. I was just going to talk about that. Okay, that's great. Are there other questions or comments at this point? Because I have one more. I have lots of questions. I mean, this is very, very, very exciting talk. Any other questions or comments? Either put them in Q&A, or if you don't have Q&A, put them in chat. Okay, so here's my question. Okay, in November, we're going to the polls and we're going to elect the entire House of Representatives, pretty much. We're going to elect a third of the Senate. How can voters get access to information about where candidates stand on these issues? Is there a sort of central clearinghouse for this information, or do people have to pretty much figure it out themselves? But when they're going into the voting booth or wherever they're voting these days, what's the best way to find out how candidates in their electoral districts and in their states are, where they stand on some of these issues and what they're advocating for?
And I can start, Yuliya. And I know Yuliya is our policy advocacy director, so she will have more to add. But for me, I would start with looking at the bills that center moms and families and see what representatives and senators are co-sponsoring those bills. That's the easiest way to tell if someone in your state, your elected officials in your state support bills that improve maternity care for birthing people. So I would start there. If you also go to the congress.gov website, you will be able to see all the co-sponsors of bills. Sometimes it's a few days delay, but it's an easy way to start as we head to the polls. And Yuliya, I'll let you take it away.
That's a great question. I'm in Pennsylvania and we're about to have a primary. So I was doing my research this past month. I'm not sure there is a national resource, although if somebody knows of one, please put it in the chat because I would love to know. But I always go to my local resources, like your local newspaper typically will have a list of everybody running and give you a hyperlink of a summary of their platform and kind of things they're hoping to accomplish if they're elected. If they are a current official, echoing what Laneceya said, you can either look on their website or look at what bills look under the bill to see if they're a co-sponsor. But for example, there are lots of new folks that are running in Pennsylvania that have not been elected officials. And so sometimes they don't address everything you want to know. And it's completely appropriate to reach out to their team. So I've reached out to somebody running in my community and I asked questions about like maternal and women's health. So you can also do that, but you don't have to go very far usually. Just Googling your state's election will typically bring up a link from local publications to help you. And then you can either find out what they're already co-sponsoring or ask them questions because they're running to represent you. So you want to make sure that what's important to you is also important to them.
Great, good advice. Excellent advice. And also, I would say that if there are students in the audience right now, a great summer work opportunity. It's not a paying opportunity. Is find a candidate who supports your ideals and your values and volunteer for whether it's a congressional candidate or a senatorial candidate. These candidates are always happy to have additional people on hand to do all sorts of things for them in their offices, either their main headquarters or their regional offices. So to get involved. Any other questions? We're still 15 minutes away from the top of the hour, which is lots and lots of time to ask a question or make a comment for our presenters this afternoon. Go ahead. Don't be shy. I'm sure they'd be delighted to answer your questions. So while we're waiting for more people to chime in here, I'll ask another question. So, after the 2022 election, the midterm election, then of course we've got our sights on the 2024 presidential election. And so starting right after this current election, if there's like one item that you want to get on the political agenda, get it in front of the American people, get it in front of the presidential and vice presidential candidates, what would that be? If you had that genie coming out of the lamp, and not three wishes, but just one, okay? Because it's inflation, high inflation right now, so you can only get one for the price of three. So anyhow, if there was one item, what would that one item that you'd want to get in front of the American people going into the voting booth in 2024, and obviously at the same time in front of the candidates?
I think that I'm going to cheat a little bit since the Black Maternal Health Momnibus is a package. It's still one item. It's just composed of about 11 or 12 things. So I'm going to cheat a little bit and say passing the full package this time would be important to improving maternity health care in the United States. And it would definitely decrease the number of maternal morbidity and mortality outcomes that we have. So I'm just going to say the full momnibus. But Yuliya, what do you think?
Oh, it's such a hard question. I think because this has also been an issue, what I'm about to mention has also been an issue for quite some time. And I know we can do it, and it's not like as far of a stretch as universal health care, but paid family leave. We have to get families paid leave and resources to be able to care for not only their children, but their family. That is such a big barrier to financial barrier, social barrier for families and moms and childbearing people in general. Really, we don't have any kind of paid leave policy, and we're the only industrialized country that doesn't. And like, we're always at the bottom of the list of most all countries have some sort of paid leave policy. So that would be my pick, because I think it would address a lot of the things we've talked about today. It's a social policy that would address a lot of health effects and poor health outcomes.
So the omnibus and also paid family leave, which of course, I remember, Al Gore putting that on the agenda way back when. So this is probably something which is long overdue in the United States to be addressed, and it certainly would respond to inequities and inequities in general, but also it would probably provide a fair amount of relief to struggling families, for not only in the middle class, but of course in the working class as well, at the very basis, it would be in my opinion, it would be the humane thing to do. Anybody have any questions or comments for Laneceya or Yuliya? We are 9 minutes away from top of the hour, which is still a lot of time to express your opinion, share an observation. Anybody out there? Hello. And we do have participants. We do have attendees. So again, don't be shy. So what's next on your itinerary after this conference? Where are you going to be presenting or speaking? Where are we going to find you?
You want to?
Sure. I mean, right now, really, our biggest focus is on our national event. That is our biggest event, and also kind of one of the ways this organization was conceived, pun intended. We usually have a event in Washington, D.C. every year. And the point of that event was to get as many families and moms on the National Mall in Washington, D.C. to show our legislators power in numbers and demand that families have for better treatment. So you will see us, as this flyer says, at the District Wharf. And then the following day on June 6th, we're holding an advocacy panel to discuss state and federal maternal health legislative advocacy successes. I think this topic in general, whether it's maternal health advocacy or advocacy overall, things move quite slowly. It can be quite a discouraging thing to get involved in, and that is normal to feel that way because things move slowly. But I think it is important to point out what has worked. We always hear about bills not passing and people getting disappointed and things not being included. But there is success and value in things that people are doing the work on the ground. So we wanted to highlight that. So that will be live streamed on June 6th.
Excellent. We do have a question from Leona Palmer. Can you speak to how the Black Maternal Health Omnibus Act or other maternal health policy initiatives are addressing pre- and postnatal mental health supports in light of rates of pre- and postpartum depression and anxiety skyrocketing during COVID?
Absolutely. So there is a bill in the package that addresses maternal mental health. But also we are involved in advocating for some of those budgetary policies, like increasing the funding for the maternal mental health hotline, increasing funding to do screenings and things like that to be able to diagnose maternal mental health, and also offering solutions to that as well. So there are things that's moving very quickly with maternal mental health, I would say, when it comes down to federal policies. Yuliya, you have anything to add?
The only thing I'll add is that it's good to have legislation. We need more of it. We need more comprehensive. We need reform of how mental health is addressed in this country in general. But Laneceya is right. There are initiatives that are already ongoing, especially at the state level, and also on the federal level. I'm not sure what state our question, it disappeared. I forget who asked it, the name of the person, but you can check out the state that you're in and see if there's already initiatives ongoing. It's really important to ask your legislators for renewed funding on things that they've already passed. So just because a bill has passed or an initiative has passed does not mean that money will be given to it forever. Every year the budgets are redone. And so it's important to reach out to your legislators and say, hey, this was a great policy. Thank you for being a co-sponsor. Thank you for voting yes on this. I want to ensure that there's funding that continues for this initiative, whether it's a hotline or anything like that. We definitely want to ask for continued and increased funding for past legislation or past initiatives.
And also, I just wanted to add that it is Maternal Mental Health Awareness Week. So you will be able to find some programs that's happening too outside of the policy aspect of maternal mental health across social media with some of our partners like the Blue Dot Project, the Maternal Mental Health Alliance, and others.
Well, thank you, Laneceya. Thank you, Yuliya. Any parting words in these final couple of minutes? Anything else that we need to know? I think we need to know a lot of things, but in a couple of minutes, any last ideas, last words?
I would say, like Yuliya mentioned, if you have any outstanding questions, if you want to learn more about how to get involved, please utilize our contact information. We are here to help. We are here to amplify solutions. So reach out to us at those email addresses. Also, an easy thing you can do to follow along with what we are advocating for, and we share a lot of information on our social media channels. So you can follow March for Moms on Twitter, Instagram, and Facebook. We share a wealth of information on there. So you'll always be able to be in the know on things that's happening and moving in the maternal health landscape.
Excellent. Thank you so much. Thanks to both of you for this really amazing presentation, just full of great information, useful policy ideas. It's been a pleasure hosting you today at the conference. The conference continues all afternoon into early evening. So stay with us. Check out some of the other sessions, and if you can't attend the session, everything's being recorded. Have a great afternoon, everyone. Thank you again, Yuliya. Thank you again, Laneceya. It's been wonderful. Thanks again. Bye-bye.
Thank you. Have a good evening.